We've done our opening, we washed our hands, we came in and gathered our supplies, right? We come in, we've gathered everything. We told Mrs. Jones we're going to get warm water and we'll be right back, okay?
It's cooking with the water.
Good. You asked her to test the water. It is okay to bring a paper towel with you so you can wipe her hands off because, I mean, it's going to be wet, right? So Mrs. Jones, before we begin, I'm going to cover you up with this. We can protect your chain and I keep pulling. Before we actually begin our procedure. So even before I put on my gloves, because the glove is when we actually will touch the resident. Before I put on my gloves, I'm going to go ahead and prep the pad because I'm going to put this pad under here. You can put it this way or put it that way. And put on my gloves because I don't want to touch the soil pad with my clean hands. So now I'm going to ask Mrs. Jones to scoot over to me before we can roll her because we scoot towards us and roll. In case Mrs. Jones cannot, we do it in section. Now she can. We are only using a mannequin, so we scoot her towards us. So 1, 2, 3. Cover her up. If it's a whole human being, he will be able to help us. But now it's not. So this is rolled towards us because it's clean. Clean towards us, dirty away. And we put it right there underneath the dirty one. And we put Mrs. Jones back. Scoot her in the middle or ask her to go into the middle. We go to the other side. Roll to her side. Covering her. We take this nicely out, put it in the trash. And now we have a clean barrier for her to lay in. And we can begin our procedure. And feeling comfortable. By so doing, I have to expose your perineal area, okay? I'm going to bring this up. I have to expose it, so I'm going to bring the protective cover up by rolling it inside out to keep her gown inside. Is that okay? So this is how I'm going to roll her. And then I've exposed the woman area. Okay. So now, can you come closer, please? This is the woman, right? We have folds, we have covers, and you have to open up and wipe. So you're going to be using your thumb and your index finger to spread open, and then you can wipe. That is how you wipe. But then you have to get your soap and your water first. You wring it out. You squeeze the water out of it. Don't touch it first. I was just showing you. Okay. You make sure you have your folds and you have your 4 or 5 corners, and you put soap in each corner that you're going to be using to clean. So we have 1, you put soap, you do that, Then you open, you put another soap, you open another soap, and we are allowed to use the bag as a fourth washcloth, and you have to make sure you lather it. So now you go into Mrs. Jones and then spread her woman up, and you use one side of the cloth top to bottom. You go in and wipe down. Now that is dirty, right? So you come here, put it off. You have a clean space. You clean top to bottom. You take it off, another clean space, clean towel. You come to the one close to you, you wipe top to bottom. You take it off. You have another clean space, so you go in between the tie folds, right? And then you wipe down top and bottom. Then you have the feet side that you can use to wipe this top to bottom. Is that okay? All right. You set this aside because we are not going to put it back into the soap. You pick one clean towel. This is going to be what you're rinsing with. I don't know. I didn't do this. Maybe there was soap in the bowl, but I didn't do it. So now you have a clean towel to rinse with. Whenever we wash, we rinse. So you have one top to bottom, two away from you, three close to you, four on the side in between the tie fold, five on the other side. You're good. Then you set it aside. Now you pick up your towel and you dry. So you wash, you rinse, you dry. You pick up any point and you tap in between from you. You just have to tap. No rubbing, no, because the towel is dry, right? Good. Then you set your towel aside. As if she's comfortable, if the water is cold, if she felt it was cold, if you think the water is soapy or anything, or is cold to you, you take off your gloves, you go get another clean water, okay? But we're still going to be using it, so you take it away. Can you scoot towards me? Mrs. Jones is going from you, from bottom to top, close to you. Then the last layer goes back again from the anus to top. We have washed, we have rinsed. What do? We pat dry. We pat dry. So now you're going to pat dry. Now Mrs. Jones is nice and clean. At this point, Mrs. Jones is going to lay back. We situate Mrs. Jones, making sure she is nice and comfortable. Are you okay? Did you feel any pain or discomfort? No, she is fine. So we're going to move this away. And now we have to take the dirty linen, right? So we're going to go back in. Mrs. Jones' arm is in the way. This is dirty, so it's folding away from us. Push it in. And we have the clean one, which is going to be folding towards us. push it in. Mrs. Jones can help us turn a little bit, and we can do all that, and then she lays back. Mrs. Jones is going to help us turn, and we pull into the trash, and that pulls out. Put all of these in the hamper to wash it. We are going to go to the throw away that, clean her policy, disinfect as we're supposed to, pick it up with 2 towels, paper towels, come in with a paper towel, pick up these, and then go store them with a paper towel, because wherever we're going to be opening, we are going to be opening with a paper towel. We take this with this card, we take that with this card, because now we are completely done with our scale. That for us, and we pull this back.
With the gloves on.
So now we're going to be pulling this back on. We're going to open the privacy blanket, ask Mrs. Jones if she needs anything, turn the TV on, give her a newspaper or something, and we go wash our hands. Voila.